Yes. Welcome back to Cheddar Health and Wellness in partnership with Walgreens, everybody. We are in this together. According to the CDC, heart disease is the leading cause of death for men and women in the United States. Joining us now to discuss is Dr. Anita Gupta, anesthesiologist and faculty member at Johns Hopkins School of Medicine. Doctor, great to have you here with us today. Let's dive right in the interest of time. How common is heart disease, and what are some of the factors that actually cause this disease?
Well, heart disease is very common. A heart attack occurs every 40 seconds and is one of the leading causes of death in the United States. And a person dies every 37 seconds in the United States from heart disease. And as you know, Americans have a heart disease. Every 1 in 4 deaths is due to a heart attack. And that is really one of the major costs in the United States that affects deaths. It affects medication costs and lost productivity. Now, what we really need to understand is it's very important to have early action to prevent a heart attack. And that's especially true if you are overweight, you have diabetes, you have high cholesterol, high blood pressure. The more risk factors you have, in fact, you should be more concerned that you could be heart related.
And so what are some of the signs that your heart is not working properly?
Right. And that's what's key to remember here. Not all problems that are related to heart could be clear heart signs. You know, you're not going to have a fall to the floor if you're having a heart attack. So it's really important to know what's going on. If you're not sure, you need to get checked out. So especially important to look for chest pain, of course, discomfort, shortness of breath. If you're having any nausea, indigestion, jaw pain, stomach pain, or dizziness. Any type of tiredness, coughing, or irregular heartbeats, all of these symptoms could certainly mean that there's an impending heart attack.
Okay, so naturally, I feel like I got to know what's the best exercise for preventing heart disease.
Right. So look, exercise obviously is one of the most effective tools for strengthening heart muscle. And obviously keeping weight under control is very important to ward off any type of damage to the heart, but especially important if you have high cholesterol, high blood pressure. That certainly can prevent it. But there are different types of exercise. There's aerobic, there's strengthening of your muscles, and there's obviously resistance training. And each of them has very different types of effects. For example, aerobic exercise can really improve the heart strengthening of the muscle. Resistance training can improve the flexibility. And certainly if you do all of that, it can really build the good foundation for exercising and really have an effective regimen. Now, what's critical to remember is to do 30 minutes a day, 5 days a week. And that's really when you build that circulation for your heart, lower that blood pressure and heart rate, and ultimately build a long-term plan for your health.
Okay, 30 minutes a day, 5 days a week. But what about eating healthy? We all know that eating healthy will keep you healthy. So what are some of the heart-healthy foods that we should be adding to the diet?
Right. Of course, diet is number one. Alongside a healthy diet and lifestyle are your best strategies to fight heart disease. And it's not as hard as you think. People can certainly remember to have an overall pattern of choices. That is really the simplest ways to have a lifelong plan to heart health. Eat a variety of nutritious foods and from all food groups. And it's so important to have plenty of food and nutrients to stay healthy, but super important to have nutrient-rich foods that are high in minerals, protein, whole grains, to control your weight and cholesterol and blood pressure. It's important to have an overall healthy dietary pattern that limits saturated fats, trans fats, and sodium. And if you're going to eat red meats, you want to check the label. You certainly want to make sure that they're the most lean cut meats that are out there. There's a specific diet called the DASH diet. The diet approaches to stop hypertension, and that's something you can discuss with your doctor. That's really adapted on reducing blood pressure, and you certainly can adapt it based on your cultural preferences and your food preferences as well.
All right, I'm going to count this as discussing the DASH diet with a doctor here on the day. Thank you so much for the time, the insights. Of course, I will have the conversation with my doctor as well. Dr. Anita Gupta, who is the anesthesiologist and faculty member at Johns Hopkins School of Medicine, kind enough to take the time here today.